Okay, good day everyone. Um, Today we are going to be talking about the gross anatomy of the back, just an introduction to it. The back is the posterior aspect of the trunk, extending from the base of the skull, all right, to the gluteal region, okay, and laterally to the posterior axillary line. Now, unlike the pectoral region, which primarily connects limb to the trunk anteriorly, the back is primarily concerned with posture, movement of the vertebral column, protection of the spine, attachment of upper limb to the axial skeleton, transmission of weight. It is structurally strong, very layered, and highly organized. Now, what is the functional significance of the back? The back performs five major functions. It supports the head and trunk, maintains upright posture, protects the spinal cord, allow movement of the vertebral column, and also serve as an attachment site for upper limb muscle. Now, the back is therefore both a supporting structure and a movement apparatus. Now, what is the regional division of the back? For anatomical study, the back is divided into the cervical region, the thoracic region, the lumbar region, the sacral region. Now, clinically, this division corresponds to common pain syndromes, for example, cervical spondylosis, lumbar disc prolapse. Now, what are the layers of the back? From superficial to deep, we have the skin. We have the skin, we have the superficial fascia, we have the superficial muscles, that's the extrinsic muscle, and we have the deep fascia, that is the thoracolumbar fascia. We also have the intrinsic deep muscle, the vertebral column, the spinal cord, and meninges. Now, this layered arrangement is very, very important in understanding surgical approaches, abscess spread, and nerve injury pattern. Now, let's classify the muscle. Back muscles are divided into two main groups. That's the extrinsic layer, that's the superficial muscle. These are primarily involved in limb movement. They include the trapezius muscle, the latissimus dorsi muscle, the levator scapulae muscle, and the rhomboid. Now, these muscles are supplied mainly by the anterior rami or cranial nerves, not posterior rami. Please take note of this. Then we have the intrinsic deep muscles. These are the true back muscles. They are there to maintain posture, control vertebral movement. They are innervated by posterior rami of spinal nerves, and they include erector spinae, transversal spinalis group, and deep segmental muscles. Now, let's talk about the vertebral column. Now, the vertebral column is the central structure element of the back. It consists of the 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 fused sacral vertebrae, and 3 to 4 coccygeal vertebrae. Now, they function to support body weight, protect spinal cord, allow flexibility, transmit load to the pelvis. Okay, now let's look at an important fascia called the Thoracolumbar fascia. The Thoracolumbar fascia, it's a strong aponeurotic structure in lumbar region that includes the deep back muscle, serve as attachment for latissimus dorsi, transmit forces between the trunk and the limb, and it's very important for lumbar stability. Okay, and what about the neurovascular supply of the back? Well, the intrinsic back muscles are supplied by the posterior rami of spinal nerves. Blood supply is actually segmented from posterior intercostal artery and lumbar artery. Now, this segmental organization actually reflects embryological development, so it's important. Now, what are the surface landmarks of the back? Important landmarks of the back include external occipital protuberance, spinal processes, scapular spine, that's the T3 level, inferior angle of the scapula, that's the T7 level, and of course the iliac crest, that's the L4 level. Now, the L4 level is clinically important for lumbar puncture. I want you to take note of that. What is the clinical correlations of the back? The back pain is one of the most common medical complaints people get, and it has a lot of causes and includes muscle strain, intervertebral disc prolapse, degenerative spondylosis, vertebral fractures. Now, lumbar puncture is performed between the L3 to L4 or L4 to L5. And of course, infections and tumor may spread alongside the fascial plane. So now the summary of this is this. The back is a posterior organ. It's a protective structure, is a movement apparatus, is a force transmission system, and it is structurally layered and segmentally organized. So it's studying this introduction that I've just done makes detail of the back muscle, the vertebral joints, the spinal cord, and of course the fascia. It makes it so much easy. So I hope this helps. Thank you very much.